This was a scene inside one of London's central train stations last night, not long after the announcement of a new lockdown.
We do apologise for the overcrowding issues on this train this evening.
A rush to get out of the city with just hours to spare before new travel restrictions would make it illegal for many to leave the capital. The new lockdown was announced just days after the Prime Minister said cancelling Christmas would be inhuman.
Given the early evidence we have on this new variant of the virus, the potential risk it poses, it is with a very heavy heart, I must tell you, we cannot continue with Christmas as planned.
That variant is believed to be 70% more transmissible and is being blamed for a surge in infections. Today, the number of new coronavirus cases in the UK hit a record high, nearly 36,000.
The new variant is out of control and we need to bring it under control.
Several countries announced today they are temporarily halting travel from the UK because of the new variant, including the Netherlands, Germany and Italy. But some say those measures won't stop the variant from getting out.
I think it's almost inevitable that this virus will spread globally, will cause substantial increases in infection rates in the countries that it does spread to, and it will be very difficult to control.
I mean, I don't like it, I really hate it, but what can we do, you know?
On the quiet streets of London today, a sense of anxiety, but also frustration.
I think the lack of planning and the lack of ability to tell people that this was going to happen in advance of when it did caused a lot of havoc and confusion.
Empty streets, something Londoners will have to get used to, because this lockdown could last for months. Farah Morali, CBC News, London.
And details on Canada's restrictions on UK flights are just coming out tonight. Ashley Burke is tracking them. And Ashley, what will they look like?
Well, a number of flights landed in Canada today from the UK, but those will be the last of them for now. As those planes were up in the air, the government's highest officials were on the ground trying to figure out what to do. The Prime Minister and Minister of Health held a call with the Incident Response Group, and they decided not to divert those aircraft on the way here. Instead, Transport Canada issued a notice temporarily restricting all flights to Canada with passengers from the UK. Now, that ban is effective midnight Eastern Time, and the Minister of Transport deemed it was necessary to protect the public. The restrictions are in place for 72 hours so the government can assess the situation. The Canada Border Services Agency confirms they are setting up additional screening measures at airports. We'll have more agents on site patrolling to see if anyone looks ill, and more scrutiny over travelers' quarantine plans. And those who arrived from the UK today went through all of those additional measures.
Even before today, there were restrictions on who could fly here from the UK.
Exactly. There are hundreds of people who have flown to Canada from the UK this week. They were on nonstop flights arriving in Toronto, Montreal, and Vancouver. And since foreign nationals aren't allowed in Canada, those on board are either Canadian citizens or they fall under certain travel exemptions, including reuniting with family here in Canada. Now, all travelers, regardless of where they're coming from, must self-isolate for 14 days. Border officials are expected to crack down on this even more now and go back to those who arrived this week to ensure they're in self-isolation.
All right, Ashley, thank you. Let's bring in infectious disease specialist Dr. Isaac Bogosh, also a member of the Ontario COVID-19 Vaccine Distribution Task Force. So, Dr. Bogosh, as we heard, some people are describing this variant as much more contagious, but what do we actually know about it?
It's kind of interesting because we don't actually know a lot about this variant of the virus. We certainly know what the genetics are, but how this manifests in real-world settings is still unclear. It certainly might be more contagious, but it's not entirely clear if it is, to what extent it is. It's not entirely clear if it causes more severe illness, although early data demonstrates that it probably doesn't. And the other big unknown is how this impacts vaccine efficacy. So all of these are unknown questions, and certainly these are all under investigation right now by the UK authorities.
And I'm really curious, as an infectious disease doctor, when you heard this news in the last 24 hours, how alarming do you find it?
In all fairness, not that alarming. We've seen this a couple of times already throughout the epidemic. We know that the viruses mutate, and that's just what they do. And most mutations aren't going to do anything. And at the end of the day, what are we going to do about this? We're going to still put on our masks indoors. We're still going to physically distance ourselves. We're going to avoid getting the infection using all our public health measures that we have. And I think we'll need to hear more about this from the UK authorities, especially with regards to vaccine efficacy.
And I'll be talking to one of your colleagues about vaccines later in the program. Dr. Bogosh, thank you very much.
My pleasure.